Now let's go to actually postpartum. And we had a lot of questions there as well. So, of course, let's start with what are the common pelvic floor issues that can arise during the postpartum time?
Well, basically, the whole same list of things that can happen when you're pregnant. I would say one of the major things I see is urinary or fecal
Uh-huh.
leakage, or the inability to hold gas in. This can happen for many reasons. Again, when we go back to this cervical dilation, we all think about how much your pelvic floor has to stretch and expand. It's
Mhm.
going to take a while for you to regain that same level of contractibility. If you think about your arm, if I'm starting from a really stretched position and you give me a weight, it's going to require a lot of power and even strain to try to
Mhm.
get a full contraction, as opposed to starting in midline and you ask me to contract. Now I have more robust power.
Mhm.
Um, on the flip side, what I see with urinary incontinence too sometimes, especially if it's a traumatic birth, is the pelvic floor muscles will retract and retreat as a protective mechanism. So I frequently see people in postpartum who have tight
Mhm.
pelvic floor muscles that cause urinary symptoms.
Mhm.
So for example, if you're laughing, sneezing, or coughing, which means that I have to contract my pelvic floor muscle to close off the urethra, lift the bladder to prevent leakage, I'm
Mhm.
only going to have this amount of range of
Mhm.
motion and not a lot of power to meet the demand of the pressure that's coming from above.
Mhm.
Um, so that's one of the things that I treat people for postpartum. Another very common complaint is painful intercourse.
Mhm.
And so frequently what happens is you go to the doctor's office at 6 weeks and they basically say, okay, you're not actively bleeding. You can go back to whatever activity you want to do,
Yeah.
which is quite silly because if what happened to a man's quadricep during a football game happened to a woman or birthing person's pelvic floor during birth, they would be in therapy for 1 to 2 years. And so one of the reasons why people can have painful intercourse, especially at that 6 week mark, is because of an area called the vestibule. So when you look at the vulva here, inside the labia minora, there's a line here called Hart's line. Um, Everything from that line inward before you actually go into the vaginal canal is called the vestibule. This area is very hormonally mediated in that you need certain levels of estrogen and testosterone to maintain homeostasis, to keep
Mhm.
it cool, to keep it unirritated, to keep it well lubricated. Well,
Mhm.
guess what happens when you breastfeed? Your
Yeah.
body is in a state of menopause,
Mhm.
and that has consequences on the vulva and vaginal canal.
Mhm.
And so, even if you don't have a muscle issue, you might have a tissue issue.
Mhm.
And so, in this case, what I do is I do a vulvar exam, I separate the labia, I'm looking at this tissue. If I see tissue that is red and irritated and dry, maybe crackly a little bit,
Yeah.
um, often what I will do is say, okay, let's have a conversation with your doctor about some kind of topical cream that we can use in the
Mhm.
meantime while you're breastfeeding, to help heal this tissue. So
Mhm.
that can be one source of painful penetrative sex, is that the tissue just isn't ready
Yeah.
to be rubbed up against, to be quite
Mhm.
honest.
Mhm.
And then if you think about your ability to self-lubricate is diminished a little bit, you also might not feel confident in your body, so your libido might be low.
Yeah.
You may have to use more lubrication, and we
Mhm.
always recommend a water-based lubricant that does not have glycerin in it. That's going to be the least irritating.
Mhm. Mhm.
So sometimes penetrative sex can be painful because of that as well. Um, Outside of a tissue issue, usually it's because the pelvic floor muscles are tight,
Mhm.
one or all of them. In which case we use principles called down training, where we're teaching those muscles to lengthen again, to get them to relax. We're using breathing techniques, we're using manual therapy, which means I'm going in and either stretching them or using trigger point release or massage therapy techniques,
Mhm.
to get them to release and relax and open.
Mhm.
So I would say, the two biggest things I see postpartum are leakage and painful sex. And then once people are ready to get back to their normal activity, they may not have leakage until they go to run, for example, in which case we have to do more things like running analysis, where I'm taking videos of them running and we're really nitpicking apart all of these different changes. In pregnancy, we talked about the changes to the pelvis and posture. What we find in the research is that those changes persist into the postpartum, even after the baby is out of the body. And so if we haven't addressed those during pregnancy, they need to be addressed postpartum.
So another, like, I think two people asked me this question about tailbone pain. So if you can address that, yeah.
Sure. So tailbone, when we say tailbone, we really mean the coccyx. Sometimes people say, oh, my tailbone hurts, and they point to up here. That's really the sacrum, and that's something that's different. The tailbone is the coccyx, which is right here. All of those levator ani muscles that I was talking about, the muscles in the bowl, that's where they originate. That's where they attach to. So people can have tailbone pain for a couple different reasons. Sometimes the bone itself fractures during birth. If you've had a traumatic birth, if you have a birth that's going really, really quickly, that bone can break. If your natural resting place for the coccyx bone is forward and you're trying to push a baby, sorry, my angle's not very good, but if you're trying to push a baby out through a bone that's a bit forward, it can kind of get displaced a little bit. So not a true fracture, but it might kind of move or twist or be deviated off in a different direction. So that can be a source of tailbone pain, or it's a common referral place for tight pelvic floor muscles too. And so that's where getting with a pelvic floor physical therapist can help you figure out exactly which one of those is the source of your tailbone pain. And the tricky thing about recovering from pelvic floor issues is that they're really the only muscles in the body that we sit on. You know, if you fractured your ankle or sprained your ankle, you wouldn't be sitting on it while it's healing. And so healing often takes a little bit more time, and it requires some creative thinking to get you in more therapeutic positions to allow healing.
Okay. So another question was around, you already addressed the painful sex. So one question was around the scar pain. Like one person said that after vaginal birth, they had a tear and they had like pain. So, you know, how could they address that?
Yep. So I'm assuming they're referring to perineal tearing. So perineal tearing is when you tear the muscle of the perineum. Grade 1 is usually just the skin. 2 is about halfway. 3 is to the external anal sphincter, and 4 is all the way through. Just like any other scar in the body, it can be painful. Oftentimes what I'll do once it's fully healed, there's no sign of infection, there's no redness, we will actually do perineal massage, so similar to birth preparation, but you can actually kind of lift the tissue and do some soft tissue mobilization to the scar tissue itself. But only once it's fully healed, stitches have been removed or dissolved before it's safe. But that can also be a source of painful intercourse too.
And there's this question we have right now. How do you progressingly running routine to prevent the leakage from getting worse? Any functional regime?
Yes. So there is a really, really great study and protocol that came out of somewhere in the UK a couple years ago. That was a return to running protocol postpartum. And what it says is we really shouldn't begin running until at least 12 weeks postpartum, if not more. A lot of people start running too early and the tissues aren't ready to accommodate the changes in intra-abdominal pressure.
So there's another question if you want to read that.
Can symphysis pain also refer to the clitoral area? Yes.
Okay.
Yes.
Yeah.
Put simply.
Okay. You know, we had a lot of questions around the things that new moms can do. You know, if they're experiencing something, like the kind of exercises they can do at home. Some were not sure if they were doing the exercises correctly. So, you know, if you could recommend some simple things that they could get started on, you know, right during their postpartum phase.
Yep. So again, very general. I really, really prefer that people have an individualized program and see a pelvic floor physical therapist to get an individual program. But generally, the first 2 weeks, you should be resting. Rest, rest, rest. You've just run 2 to 3 marathons. I mean, really think about it like that. You should be resting, recovering, eating well, drinking plenty of water, building community around you, letting people take care of you, which is hard for moms. Beyond the 2-week mark, begin with a gentle walking program. Start just getting your body moving again. Decrease the pressure. At that 4-week mark, depending on what your symptoms are, maybe we start some low-level breathing and engaging of the core on your back. We might try some different things on your side as well, or maybe on your hands and knees. Inhaling to let everything relax, exhaling to engage and cinch everything in. And just start moving the arms in different planes, moving the legs in different planes to get the body online again. When you've been cleared at the 6-week mark, that's when we can start to ramp up the intensity a little bit, again, depending on what your symptoms are. On the Pelvic Health YouTube page, on our TikTok page, on our Instagram page, we have a lot of information about just some basic exercises that are usually pretty safe for most people at home. And those are good resources for people of how do I just get started? How do I start to kind of get all these things to come together? I'd say that's a good place to go first if you're not quite ready to go in person to see a pelvic floor physical therapist.
So, to end this conversation, there are 2 more things that I want to ask you, which, I think would be really important for all the new moms. First is, what is the number 1 thing that you always tell women who are expecting?
Hire a birth doula.
Okay.
Hire a birth doula, educate yourself as much as possible, not in a way that's hyper-vigilant, but generally the more you know, the more confident you're going to feel. This time can be really fulfilling and so empowering, but it also can feel really scary. And so if you're somebody who feels that way, if you don't have enough information, ask for information, advocate for yourself, and create community that's going to advocate for you, whether that's hiring a birth doula or empowering your partner or finding, a different birth practitioners. You don't have to go with the first one you're assigned to. You can get second and third opinions and really find the right person for you. That's the person who's going to be your coach at the soccer game, right? You want a coach who's going to support you and knows you and your body really well. So that's probably my number 1 recommendation is hire a birth doula, create community for you where you're going to feel supported and loved and cared for in the ways that you need and deserve.
So in terms of taking care of their pelvic health, what is the thing that you suggest, people who are expecting?
Yeah, go see a pelvic floor physical therapist, get it on the schedule, even if it's just one time, again, just to get a baseline status of where you are. It can feel really empowering. The other thing I really recommend is pull out a mirror and look at your vulva. If you don't know what your vulva looks at baseline, how can you know if something's wrong? So in postpartum, frequently, people will say, oh my gosh, I had no idea that it looked really red and irritated in this one spot, and I've been putting my cream in the completely wrong spot. So again, look at it, get acquainted with your body. It can be a really empowering experience.
So let's say, if somebody cannot hire a doula, or if, somebody doesn't have access to a pelvic floor therapist, then what are the things that they can do on their own while they're pregnant, in order to be in a better shape, when they're going for labor?
Keep moving. Get on a good walking program, get on a good exercise regime. It's not only good for your whole body, but really good for your pelvic floor. If you don't have any issues, maybe it's safe to assume that you can do some strengthening of your pelvic girdle and pelvic floor those first 2 trimesters, and then transition into a stretching mobility program. That's probably the best, most general recommendation I can make. And again, we have a lot of resources on our website to help facilitate that.
So again, the same question for somebody who is a new mom, a
Yeah.
postpartum phase.
Hire a postpartum doula. Get a
Yeah.
meal train going. Make padsicles ahead of time. Padsicles are the pads where you use aloe and
Yeah.
alcohol-free witch hazel to heal yourself. Really rest those first couple of weeks. Let people take care of you. Your pelvic floor needs to recover. Again, if what happened to a football player's quadricep was the same thing that happened to a woman or pregnant person's pelvic floor during birth, you'd be in therapy for a long time and you would allow yourself to rest. You don't have to do everything. So let your pelvic floor rest at least those first two to 3 weeks. And then as soon as you're able, again, just slowly progress into moving again, slow and steady. And the other thing I often say to patients is, when the placenta is born, it leaves a wound the size of a dinner plate on your uterus. And if that wound was anywhere external, you would be resting. So really rest, again, those first couple of weeks. So often I see people jump into things a bit too quickly, which can cause some issues as well. And then again, once you're ready, working on just retraining the coordination, feeling what it's like to lengthen, feeling what it's like to engage, training those muscles in different ways, the slow twitch contractions, the fast twitch contractions, and then coordinating that with bigger movements as well.
Yeah, so I think it has been, really, really helpful and a lot of information. And, it's great to have, that you came and gave all this information. Thank you so much for joining in. Thank
Thank
you.
you so much for having me.
And I would recommend people to check out their page and all the resources that Molly mentioned. And it's going to be really helpful. And we'll have this video on the feed as well for everybody to check out. Thank you, Molly. Thank you.
Well, this brings me to the end of this video. Thank you for watching. If you liked the video, subscribe to my YouTube channel, Quick Mommy Hacks, and follow me on Instagram.